Hello, my name is Erin Higgins and I am the Director of Simulation for the Women's Health Institute. Today I will be presenting a poster titled Implementation of a Standardized Multisite Interprofessional Simulation-Based Training Program in Obstetric Emergencies. Obstetrics and gynecology is a diverse field of medicine providing care to patients through office-based encounters, inpatient management, and surgical procedures. Obstetrics in particular depends on team-based care, and acute emergencies bring together caregivers of various backgrounds and training. Simulation has been demonstrated to be an effective modality for teaching technical skills and teamwork in aviation and military settings, and it has been increasingly used in healthcare in recent years. Team-based training aims to identify latent safety threats, mitigate errors, promote teamwork, and improve communication. Simulation-based training can be utilized to enhance teamwork and communication by allowing learners to practice role assignment, closed-loop communication, and debriefing skills. Additionally, it promotes interprofessional learning among learners from disparate backgrounds. Finally, simulation can be used for skills training, both for beginner level and highly technical skills. It allows for mistakes to be made in a safe setting while minimizing risks to patients. Learners can also hone skills through the use of simulation, as it allows for repetitive practice in a controlled environment. The challenge we faced in implementing team-based training was primarily related to the large number of caregivers spread over several different hospitals and units. Cleveland Clinic has 3 maternity centers in Northeast Ohio: Fairview Hospital, Hillcrest Hospital, and main campus with the special delivery unit. This accounts for over 600 caregivers. Our department has been using interprofessional team training since 2007. This program was based on a framework from Kaiser Permanente's Critical Event Team Training, or CETT. The team leading previous versions of this training was not interprofessional, and these trainings were run without Stacie support. After several months of strategic planning in 2021, our team implemented our own standardized interprofessional program, incorporating the support and expertise of Stacie's staff. An interdisciplinary team consisting of 1 OBGYN physician and 4 nursing professional development specialists developed a 4-hour simulation-based training to be carried out at each of Cleveland Clinic's 3 Cleveland area hospitals with maternity centers. The training consisted of 2 scenarios, each with different clinical topics and learning objectives. The topics for 2022 included postpartum hemorrhage, hypertensive disorders of pregnancy, and venous thromboembolism. Caregivers came from various units and different professional backgrounds. The units included labor and delivery, antepartum, and postpartum. Participants included physicians, certified nurse midwives, nurse practitioners, physician assistants, registered nurses, licensed professional nurses, and clinical clerical assistants. Caregivers registered for the training via My Learning and were provided with relevant pre-readings to complete prior to their session. All participants were expected to complete training during protected time away from clinical responsibilities. Completion of this training is required every 2 years for caregivers working on these units. After pre-briefing, learners were oriented to the simulation environment by simulation operations specialists from the Stacie. After completion of each scenario, the group participated in a formal debriefing. Facilitation was done jointly by physician faculty and nursing professional development specialists, all of whom have received formal training in facilitation and debriefing. Participants are encouraged to identify systems issues and provide suggestions for unit changes, which are reported back to unit leadership. At the end of the 4-hour session, participants were asked to complete the standard Stacie survey with regards to their experience. Since implementation in May 2022, we have completed 9 sessions, training 114 caregivers. 8 sessions have been held in situ, and 1 session was conducted in the health space building at main campus. Trainings have been very favorably reviewed, as demonstrated in this graph, with scores averaging around 7 on a 9-point Likert scale. Participants were asked to rate the following elements: their overall experience, the learning during the session, the instructors, and the relevance of learning outcomes to practice. Future steps will involve obtaining IRB approval for data collection for program outcome measures. We also plan to expand this training to other CCF sites outside of Cleveland, and we are actively working on incorporating our anesthesiology colleagues and staff from the blood bank into our training. Thank you so much for your time and attention.